ex experience in running both different types of evidence generation, and one of the most exciting ones is around evaluation, because it brings really varied perspective on what the government or all other stakeholders do in the course of the development. So that's briefly who I am, and shall we move straight to the presentation? Would you be sharing the screen?
I can share, or would you prefer you move yourself?
I can do the same, but I'm not sure if I have the right to share.
Yeah, you have. I made you co-host, so you can do it.
Okay, okay. Let me then share. Let me know if you see my screen and if it's presentation mode.
Yes, I think it's coming up, but not yet fully shared. Okay, we can see it. It's not in the present mode. Okay, now it looks good.
All right. Great. So let me start also telling my story, that when I joined UNICEF back in 2006, it was first ever post for monitoring and evaluation within the country program. And perhaps you already been exposed to extensive information about what UNICEF does, etc. And basically, it also shows how UNICEF values the functions of monitoring and evaluation. So we really learn and advance what we do for children in Mongolia. So since then, embedding the evaluation culture within the country office and within our program had quite an extensive journey, and not all the assessments and evaluations that we have done were referenced as evaluations. And here are the ones which we have done, which are in a system for which you can find all the reports and assessments of the evaluations per se. So we also ensure that the evaluations we manage within the UNICEF programs are also evaluated by the external expert group on its quality, etc. So we really ensure that the quality of the evaluations are there. So, and I'll take you through very quickly or capturing all the evaluations we have done since 2014. The first one refers to the RED strategy, and RED stands for the Reach Every District strategy. It has been initiated to increase the access to immunization services mostly. Yeah, so and even within the context of Mongolia, where we are usually very proud with having very high immunization rates, we observe that there are children who are left behind for these services even. So what have UNICEF introduced is to introduce the reach out strategy for SUM, that low administrative unit in rural area. some and family clinics to have these visits to families within the community and deliver the immunization services mostly. So what we have found and what basically evaluation have said, it says it's a very relevant strategy. It increases the cooperation between the service providers from the different entities like health and social services. It does take time, and but it has a very positive effect in the long run. And although it fails in many countries, it has also been actually said that it has been quite well organized within the context of Mongolia. And the key to making the link a success is in the moral and practical leadership at IMAC and district level. So in order to make it work, it's really important that the leaders in the communities are really into it, really deeply understand what this strategy is meant for, and then we really get the support and were able to implement it. And so basically what the strategy has been doing is the in terms of the cost, it implies the transportation cost for the local service providers to go around and find the households and learn who lives there, whether the children are taken care of in terms of the immunization, etc., etc. So what also they were finding is that, in fact, there are children who are who are not having the birth registration or birth certificate. They were finding there are children who were left out of school because parents had some disabilities and so on and so forth. So apparently it had more, it was finding not only children who were left out of the immunization services, but also many other social services as well. So, and in context of Mongolia, immunization services are organized in such a way that it's really difficult to miss these services. But nonetheless, there were children who were left behind. And one of the strongest mandates UNICEF and the human rights organizations have is to reach the very much left behind and the last child. And this is a strategy that's supposed to serve that. And recommendations were basically aligning the strategy with the overall universal health coverage concept, and for that strengthening the primary care services, which is very much in line what the government is currently doing in order to really have universal health coverage. There has been lots of gaps and organizational, operational matters between different social services, because it has been initially initiated by the Ministry of Health, but it ended up that it actually contributes in terms of different evidences to many other social sectors. It brings children left behind into the schools. It brings children left behind into the social welfare and protection services and so on and so forth. But it wasn't really well formalized, because government schemes are in a sense bureaucratic, that they need to know what each and every person within the sector does at whatever level it is. So this collaboration and coordination has been highlighted that needs an improvement. And which also implies the full integration of the those services in the daily routine of involved service providers and stakeholders, without really having a separate working groups, because most of the strategies the development partners introduce whenever it comes to the community-led type of services, it's an establishment of the multi-sectoral groups, almost with the identical composition, whether it is a livelihood committee, whether it is a red strategy committee, etc., etc. And these were the main recommendations, and to operationalize it, there has been a need for sustainable resourcing of the initiative, and now I guess it's embedded in the concept of the universal health coverage, and that's the way it goes at this moment. So there has been different types of mapping employed by the different zones and horrors, and there has been, basically it also shows that the operationalization of the project itself has been quite agile, so it can be customized by the implementers the way they think it's right to be implemented, but they were also extensively provided with the strong guidances on how to do that. The next, so it's, as you see, it's mostly a project level evaluation. The next evaluation we have done was a WASH in schools. Definitely, as you perhaps already know, UNICEF works in health, child development, education, protection, social protection, and also very much into the water, sanitation, and hygiene projects, because that's essential for human dignity, it's essential for their health, it's essential for their potentials and development. So what we have been doing is identifying the most needy areas and schools, and we have been demonstrating different models of sanitation or water supply and hygiene facilities. So that's what we have been doing. So main conclusions actually were drawn into the fact that, yes, we do provide nice modern facilities. However, guaranteeing access to sustainable water, sanitation, and hygiene practices need to have more comprehensive elements, like operations and maintenance of those facilities. Who is responsible for, how it will be funded, how do we guarantee the sustainability of that? Because in many schools and dormitories, we had a handyman, well-known uncle in a community who has not been given actually any technical training or didn't have any technical background on that. So therefore, these type of things needed to be embedded into the implementation of the project. At the same time, to facilitate that, there has to be changes in planning and approaches at the education departments at local levels, as well as the school level. Yeah, you need to also plan for this type of interventions, and you also need to budget for this type of interventions. There has been lots of behavioral elements that needed to be addressed, because any intervention on one side, it's a supply. Yeah, we bring in the water, sanitation, hygiene facilities, but we also need to create a demand and also guide both the service providers, including all the staff within the school and children who are main beneficiaries of the school, to really access it and access it properly, and also help improving those services. Yeah, so therefore the main recommendations from this evaluation was that basically it needs to be planned, experimenting more how we can improve operations and maintenance of the project itself, and have greater hygiene promotion, behavioral activities to be introduced, which is not only about, as I said before, children, but also about the service staff at schools and dormitories and so on. Yeah, including teachers, social workers, etc. So definitely in UNICEF, we do not only go to local areas and demonstrate different models of the services. What we try also to do is to bring those learning and experiments into the scale-up national level. And there has been also an areas for recommendations that we're addressing to coming up with the norms and requirements within the school and educational settings, and integrating that into the national programs, et cetera, and perhaps this is the evaluation done back in 2015, and since that you perhaps have seen that progress the government of Mongolia has made in introducing the minimum norms and standards, as well as having big programs, as well as the investments secured in a state budget for improving the sanitation nationwide in all the schools. So the next evaluation we have done is on inclusive education. As you know, Mongolia is also, again, quite proud of having the good coverage of children within the education systems. If you see also very recent survey findings, we see that nearly 90% of children get into their first grades by age 6, but again, by age 15, 99% of them acquire primary education. So we keep most of the children within the system. But the principle of inclusive education is to reach every single child with the education services that would help them to grow and develop their potentials. And therefore, but still, if we look at the dropout rates, there has been 2-3% of dropouts at every level of education, and it lasts for past 3 decades almost, and therefore reaching that last 2-3% has been extremely difficult. So what has been done is based on the evidence that showed that most of the children that who were left behind were children with disabilities. Most of the inclusive education projects were targeting children with disabilities, and that's what also has been highlighted within the findings of this particular evaluation. So government has also taken initiatives on having individual learning plans. There has been numerous capacity building interventions and supporting learning for all, having more coordination and awareness and capacity for different stakeholders, because it's not only the school who needs to be dealing with the children with disabilities, for example, but it's also the local communities, the parents, every duty bearer has a role to play. So we really guarantee an inclusive education for children. The evaluation was also highlighting some issues that we need to be addressing. So it's not only inclusive education concept, but within the inclusive education concept, what do we understand by disability has been varying from the global thinking and development. There has been a medical model of understanding of disability, which needs to be actually addressed. Bringing children into regular class is only a beginning. That's what was highlighted. Yeah, we have put tremendous efforts. Yes, we were able to bring them to schools, but were we really able to reach them out was the question that the evaluation has put in front of us. And here they've been also highlighting how do we interpret and understand the concept of inclusiveness overall, because the project has started with the mindset that most of the children that are left behind are children with disabilities. It has been heavily designed to engage children with disabilities, but inclusive education concept itself is about each and every child, regardless of their status of physical or mental disability, for example. Therefore, if you are physically healthy and mentally healthy, but you have difficulty in learning some subject matters, there has to be a system that would help children to feel inclusive and have this opportunity to acquire what they have they want to, for example. So those concepts were left bit behind, and we have been more focusing on just bringing children into the school system. And for example, out-of-school children, they were not very well considered in the design of the original model. There has been a very important question also that was put to us is, what is a Mongolian model? So basically what the evaluators have observed is because the human resource capacity building has been bit behind, many people working in inclusive education area were coming from the Soviet, how do they call it, defectology type of background and education, whereas their modern view of disability is more on the environment. It's the environment disabled and cannot integrate the people who have special needs type of perspective. So therefore one that. On the other hand, every and many different people were trained, yeah. So, and they were trained, one in America, one in Japan. Many types of models have been experimented. But out of that, to what extent the design of the project has been looking at the Mongolia specific model, that was a question mark. And it was an important question that we needed to also address, yeah, because Mongolia has, as minimum, its physical dimensions, the small administrative unit, where there perhaps would be some 10, 20 children with disabilities, but with 7 different types of disabilities. And how do you organize the services in a way that it reaches out each and everyone? You cannot be having a specialist in each and every type of disability within the one SOM. It would be extremely costly. So how do you organize it in a way that it reaches each and every? So there were many questions actually put into this from the evaluation, and another issue the evaluators identified talks about the data limitations. It's again relevant to the way we define the concept itself, and as well as the data they collect, how it is stored. Because when you come to the schools and dormitories, they would name their children, but how the planners and evaluators access those data has been a challenge. So these were identified within this evaluation, and I would not go to the recommendations in detail. So basically it says relevant, but there has to be improvements in its conceptualization and improve the modalities of implementation. There has been lots of points around strengthening the capacity on understanding the inclusive education at many different levels, and multisectorality of the initiative has been also very much pointed out. And if you see the current package of education law, actually it has a tremendous shift from the exclusive, let's say, disability-focused inclusive education to a more broader concept of inclusive education within the current education legislation. The next, so you perhaps already feel, basically most of these evaluations are more around the project evaluations. And so basically at the start of evaluation journey, we were focusing more into the specific and different projects. And COVID-19 has also been it has been a global shock. So UNICEF globally initiated a COVID-19 response evaluation. It has been managed by the global team. It has been involving different multi-country specialists, and because it was done internally, they have switched among themselves in order to facilitate certain level of independence, and this how the evaluation has been done. And it has been covering many different countries, but also they've been coming with very specific recommendations also to participating country officers. So we also questioned ourselves. We needed this evaluation in order to understand how agile and quick we were to adjust our programs to address this emerging need to address all the challenges that COVID-19 have created. And we have done, the team has done numerous also number of interviews and dialogue and discussions with different level stakeholders, including the beneficiaries, etc. So basically, it was telling to us, one of the major messages we received was around reaching the most disadvantaged. Although UNICEF has been highlighted for having a good approach and really strategizing to reaching out the most vulnerable, there was still some groups that felt that they were left out of the assistance. And also, as UNICEF, we need to be looking at the more wider spectrum of what the vulnerability means for different type of situations, and that's what has been very much highlighted. There has been also strong need for multi-stakeholder coordination, and also there has been a need that highlighted for strengthening the legislative environment around the things. One of the successes also were highlighted around the shock responsive social protection initiative that UNICEF, before the COVID, has initiated a project of cash transfers during the emergencies. Perhaps if you do not know, UNICEF original abbreviation stands for United Nations Emergency. Sorry, I forgot it now myself, but emergency fund, actually, United Nations Children's Emergency Fund, which, and therefore we have quite a strong emergency component in all our programming and approaches. So, and we have been experimenting with the provision of the using the existing cash transfer schemes in emergency setups. So let's say if drought situation, the heavy snow, heavy winter situation hits one of the areas in Mongolia, we immediately add up on child money, because child money has the largest coverage among all the social protection programs, and then we reach out the households with those type of cash transfers. And that initiative has been very much welcomed both by the government. It has been also very good learning for international community, because it has also been presented at different platforms like G20 or regional experience sharing platforms, etc. So this has been a good learning, but more coordination and coherence between the different initiatives as well as different partners. That's what the evaluation has been highlighting to us. More recent ones done in 2020 was child protection law evaluation. So in 2016, Mongolia adopted, approved its law on child protection. There has been many development partners and human rights NGOs and civil society that has contributed to having this law. There has been a very strong commitment from the government on doing these things, and that's how we came up with the law. And law itself has been prescribing of having its evaluation, because many reviews and reports were referring to the fact that Mongolia actually has extremely good legislative frameworks and platforms. However, law enforcement and implementation is a concern. Learning from those things, the child protection law initially had been planned to have an evaluation, and UNICEF came in here to support on having that evaluation done. So it has came up also with very strong recommendations. It has been, because it has been initiated or legislatively prescribed, it has been really seriously taken by the government in terms of addressing its recommendations. And therefore, the current update of the law on child protection actually includes many of these recommendations as well. So let me take just one example. This is the first one, when law on child protection was explicitly referring to all children, to Mongolian children only. And in accordance with the commitment we take under the CRC, the Convention on the Rights of the Child, the government is in fact responsible for all the children residing on the territory of that country. And that concept has not been taken into account. That has been highlighted by the evaluation, and the current law actually refers to all the children regardless of their citizenship and stateless status, etc., etc. There has been lots of recommendations also around administration, organization, the accountability layers and framework for the law. There has been a need for clarity of who is responsible for what and how. So those things were more explicitly referred in the current legislative framework, and the current also work both Ministry of Justice and Social Protection are implementing, that's around the professionalization of the social workers, standardization of the MDT services, that's multidisciplinary teams who are supposed to work on the provision of the protection services at local level, and more operational type of recommendations on improving the case management, on dealing with those cases. Another important area of recommendations were around prevention services, because in child protection, definitely, regardless of its scope, I mean, scope meaning coverage type of things, even if a single child experiences a violation of the rights, we have to have a protection mechanism and services in place in order to be really human rights and human focused country. And that's the basic idea. And that's why many child protection services and interventions largely target those affected children, and prevention was in a not very, let's say, not to the extent it has to be, because before child gets into those situations, we need to prevent them first. So, and this has been also very much highlighted in the recommendations, how do you effectively do the prevention so we do not have actually violations of the child protection rights, etc. So, and there has been also areas for family-based alternative care type of services, making them also in a very explicit forms, and there were also recommendations on improving other legislations related to family, etc., which has been also in agenda of the at least last parliament for it has been quite a heavy agenda for them. So there were many discussions around that on the family law in particular. So definitely any system cannot exist without good data systems, and I guess that's very much relevant to evaluation practitioners. It's not only about the establishing the database, which has all the details, etc., but it's about the system that continuously operates, that has quality assurance setups and mechanisms. So we really have extremely objective and timely data around that. And that's why the data systems were very much highlighted, and my child protection colleagues put a lot of effort and investment in improving the system. The system shouldn't be a standalone system. It has to be a part of the digital transformation of the government system itself, and that's why it takes a bit of a time. But nonetheless, this recommendation has also been very much strongly looked at, and definitely because the nature of the child protection, the coordination, monitoring, oversight, the engaging all the relevant stakeholders is an extremely important thing. And I guess evaluators are quite good actually in identifying and making the analysis of the stakeholders, and that's very important element actually in any project and program implementation. It's not, UNICEF is not an only player within the system. It has many stakeholders, and we have to have extremely good understanding on who plays what role and how we can improve that. So the next one is on GTA evaluation, that stands for the Geographic Targeting Approach Evaluation, and we have done it with Chimge in her capacity of the Cognos institution, research team. And just to give you also some background, UNICEF, within its approach for reaching out the left behind children in its conceptualization of equity, because there has been many geographic discrepancies in achievements of children. We've been trying different approaches in geographic targeting. So at least in the two programs from 2012, 2016, and 17 to 21, we shifted from working in Husgul and Naslach only to Захын Говьалтай, Баян Хонгор, Өмнө Говь, and Баян Зүрхэд, the more targeted, wider scope of provinces. So that's so we wanted to understand how well these different approaches work, and what were the main challenges and issues. The key conclusions were around in the initial design of the approach, there has to be extremely clear pathways that everybody and every participant of the program understands it. So that was highlighted by the team. Although the approach has been extremely relevant to government many strategies and plans, but more broader consensus has been needed, especially around the vulnerability, because and that's where we have a bit of a challenge when it comes to the issues of children. Yeah, children might have we are not approaching children like only with the health services or only with education or child protection or development services, etc. We always try to see a child as a whole. So for one child, it has to be all the participation, development, survival, education, all the rights need to be implemented. So they're impartial. You cannot divide children into the sectors, etc. And then that's why when it comes to the analysis of vulnerability, we see that vulnerability characteristics, if I may say so, vary depending on the different issues we want to address. Let's say nutrition. Yeah, nutrition, on one hand, when it comes, if we look at the nutrition from the stunting perspective, yeah, which is very much undernutrition, yeah, then it's more issue of the low-income households or very peripheral households, etc. But when it comes to the issue of obesity and overweight, it becomes more sort of a universal approach, type of vulnerability. When it comes to the new emerging online protection concerns, for example, it's more even like rich households, etc. But nonetheless, there has to be a specificity. How do we determine with the vulnerability within the specific program or project? In terms of effectiveness, it has been recognized that the approach does contribute to improving holistically the situation of children, especially disadvantaged children. But if I recall also correctly, there has been areas for improvement, especially in terms of the data collection and analysis, more deeper analysis to be done in order to really also understand the effectiveness. So in the efficiency, because many programs have been working together, it had a multiplier effect, which has been good. But at the same time, it has also been not easy to see what's the contribution of each and every component. I guess that's what the main message is. And higher level engagement that for policy and scale up, more strategic approach for the scaling up has been needed. So that were major conclusions the team has drawn, and there has been very specific recommendations developed at the strategic and the operational level. And I guess I will not go very much into it because we briefly talked at where I've been discussing under the main conclusion. So yeah, it has been a good approach, but we should have reached it out to many stakeholders who are engaged in the local development and planning processes. We need, there is a need for more quality data to understand the effect of the approach and have greater synergy between the sectors. And a more strategic approach to scaling up this type of initiatives. And last but not least, among the evaluation activities, the recent one which we are doing at this point is the evaluability assessment. So evaluation work and evaluation culture for UNICEF is not only doing the evaluations, which is the main part, but also capacity building and doing the evaluability assessment. Yeah, because we implement the programs, we take this accountability to have an assessment whether we can evaluate it. Yeah, whether we have sufficient data, whether we have the administration and management that we would be able to evaluate that. So our preliminary findings say that we have, quite a program that engaged the government and stakeholders in its design. We have more sort of a clear pathways or theory of changes for specific thematic outcomes, but there is a need for improving for some of that, and there is a need for more overarching picture of how we going about the particular, about our program itself. There is also a need for improvement of resources, the funding strategies for the program, because if program is not funded, there is no sense of evaluating it at the end of the day, correct? So funding, more strategized approach, and that clarity needs to be there. There is also a need for improving the monitoring in UNICEF. We practice results and rights-based management into our programs, and especially monitoring at output level. Just to briefly say, output result for us is the change in the capacity of duty bearers as well as the rights holders. So those areas need an improvement, and especially because of this nature of cross-sectorality or coherent, comprehensive approach to a child, more cross-sectoral monitoring results and real-time feedback from beneficiaries in particular that is needed. More participatory meaning approaches for monitoring are needed. And there are still within the at the beginning of the country program, in accordance with the evaluation policy of UNICEF, we have to come up with the plan for evaluations we are going to conduct within the framework of the running country program, but there always can be changing priorities, both derived by the global context, geopolitical context, local context, changes in the governments, and so on and so forth. So those were also taken into the account. And we were said that there is overall a strong culture of evaluation. It's not, again, evaluation culture itself is not only about doing the evaluations, but it's about also being open and transparent in all these processes. It's also about willingness of using those results in seriously utilizing and applying those findings in our programs and projects. So this is very briefly scan through of what UNICEF has done in evaluations, and thank you very much for your attention, and happy NADAM, and I'm open for any questions and queries before you go for a lunch, I believe.
Well, thanks very much, Ulrich, for very comprehensive journey of evaluation works in the UNICEF. Yeah, we've been being bombarded with lots of technical methods and things, and now it's just to see how it's in the practice and on the other side of the river, how it looks like. It's been great to see the timelines and journeys. So we open up to question. We have 10 minutes, so if anyone has question, please come to the laptop. Okay.
I have one question. Thank you very much for the presentation. I saw there are a lot of recommendations raised by the office evaluation team. Do you follow up those recommendations? And what is the frequency, semi-annually, annually? And do you disclose the latest development of the recommendations and go back to the board of directors to follow up? Or so what is the mechanism in place? Thank you very much.
All right, thank you very much. It's a very important question. In accordance with the UNICEF evaluation policy, each evaluation has to have what's called management response. And it is also tracked within the system, and we report on a quarterly basis on the implementation of those recommendations. That's a system, let's say, requirement on following up those recommendations. However, practically, evaluation recommendations are extensively also used in the design of the programs and projects as well. Those are difficult, let's say, to document often, but it's about that willingness of using and understanding and referring to the evaluations. One of the challenges we've been facing in Mongolia, and I guess Chimge and her team and also many other inspiring young people taking and bringing it over, is that evaluation, first of all, it has to be technically right evaluation, because we don't, so basically evaluation, assessment, sometimes even research is translated with the same word. I guess this has been discussed when it comes into Mongolian language, yeah? So sometimes what people often refer to as an evaluation are not evaluations per se, yeah? They are just an assessments or reviews, etc. So there has to be this technical understanding, distinguishing the two taxonomies, the two or many taxonomies, but the taxonomy for evaluation itself is very important. And I guess that culture is changing, that understanding is improving, both within the government and the technical entities and NGOs like yours, like your network. And yeah, so that's basically this moment they use. But fully agree that we need to do even more, so people really have a good understanding and making utilization really strong.
Thank you very much. Just one more follow-up question based on what you shared, because I think some of the recommendations, for example, one of them is change of the scope of the children protection law to expand the scope to the non-citizens. my personal feeling is already out of the scope, control of the management. So if you follow up with the management, even they give you a management response, but sometimes they will say it's actually that the member country really takes this recommendation or not. It's need to go to the parliament, go to the political process within the member country. So how to follow up those kind of recommendation from the management perspective? Because I assume when you follow up the recommendations based on the member response, you still follow within the UNICEF, right? Within the management. And but for this type of recommendation, how you follow it up?
Yeah, extremely good observation. Most of the evaluations, they come up with the recommendations that are addressed to the government or to UNICEF. And definitely UNICEF management response look more into the UNICEF addressed, let's say, recommendations. Yeah, it doesn't also necessarily mean that we left out the recommendations addressed to the government. Yeah, because at the end of the day, our mandate as UNICEF is to facilitate and guarantee the realization of the rights of each and every child in the country on the territory of Mongolia. And that's why within our programs, in our plans, we do take these recommendations into the account. Most of them are advocacy type of work, working with the parliament caucus or different or cabinet, etc. So the most of the advocacy work comes into the work plans of the specific sectors. And we as a UNICEF program team are ensuring that it is there. I am also the person who would question our programs. Have you been looking at this recommendations, how they are addressed in your plans, etc., etc. And it's the process of implementation of the evaluation itself is very important because we have different reference group and sometimes technical group that also involved in the process. Most of them are coming from the government and relevant stakeholders, and taking them on board from the initial stages along the process is so critical. So these are fully addressed in all potential areas of improvement. Of course, sometimes it takes time. Yeah, I mean, the evaluation has been done in 2020. We were lucky enough. It was very much demanded by the government itself. That's why the recommendations were taken very extensively in the amendments of the legislative environment for child protection in the current revisions of the law, etc. Of course, it's not that smooth in every sector or in every area. So there might be different variation of its implementation as well.
Last question. Sorry, last question. Okay. Regarding the follow-up recommendations, is there any kind of accountability framework within the UNICEF to just really push the management to take the actions as soon as possible? For example, have you seen any cases, some kind of a recommendation being there outstanding for 3 or even 5 years? Maybe when you issue the evaluation report, the management did give you some commitment as part of their management responses, but there was lack of actions subsequently. And if it's the case, what is the accountability framework within the UNICEF? Are you going to, for example, impact their annual performance, renew their contract, reduce their budget? What is your experience within the
We have there are office KPIs, and there is a strong area where evaluation is in accordance with the UNICEF evaluation policy. Again, at the country office level, representative has the first and foremost accountability for evaluations, and therefore the evaluation management response is consulted heavily also with the regional office and presented to regional office and the system, and it is accepted. Once it is accepted, you have to follow that up. You don't have almost an option not to do so. But of course, sometimes there can be cases that although the UNICEF has a strong commitment, but there are issues with the government, etc. But you can see all those reports and see where the gaps are, and you can always refer back to them to if you feel that. And that's mainly with the evaluation team. Yeah, you have to remember each and every recommendation of your evaluations. So whenever you feel, oh, it's time, I have to seem to be elaborate on this particular evaluation, then we bring it up, refer to it. Sometimes it works, often it works, but that's why one of the recommendations we also see refers to having a strong culture of documentation of the things. So knowledge management is part also of the evaluation functions within the UNICEF country offices. That's the way we try to transform the evaluation learnings into the knowledge which will be staying there, referred later, etc. If that satisfies your query.
Thank you very much. Very useful.
Thanks very much, Khurelmaa, for very comprehensive answers. And any last question?
I had one, but he asked, and then I think that the response was probably cautious.
Okay, good. All right. Then in that case, thanks so much, Khurelmaa, for your very detailed and comprehensive, nice presentation. And we will share the presentation. And if you also would like to share more additional supplementary documents, I can forward to them. And thanks very much, and round of applause to.
I also thank you very much and congratulate you. I really, when I joined, just started my evaluation career, I haven't had this many evaluation friends. I believe the number of evaluation friends are growing, and I'm very happy to see that. And all the best, and try also to enjoy Mongolia for our friends from China. And happy Nada.
Thank you very much. Bye-bye.
Bye.
Bye.